I pay tribute to both Louise Thompson and Thea Clark, for the petitioners, for raising the profile of the issue of birth trauma and helping so many other women to share their own experiences and to fight, crucially, for the changes that will prevent others from having to go through the same trauma. I also want to put on record my thanks to the member for Sherwood Forest, who's done a brilliant job with the APPG on maternity and has explained through her own personal experience today just what that trauma can mean. This debate is fundamentally about how we ensure women are being heard and genuinely heard by the National Health Service. But it's also about how we raise the levels of care so that the best are not an exception and that they're a rule. One of the missions for this government is restoring trust in maternity care. We know that that trust has been eroded by traumatic experiences, by poor standards of care, and more importantly, women feeling like no one is listening to them. The rise in maternal mortality, as has already been said, has seen in 2021 to 2023 Embrace data, compared to that of 2009 to 2011, a simply unacceptable rise in mortality. Particularly stark is the increased risk for minoritized communities, as has already been said, and those from disadvantaged backgrounds. In 2023, women living in the most deprived areas are dying at almost twice the rate of those in the least deprived areas. Seen alongside this data is an increase in obstetric hemorrhage, something I know worries mums-to-be and health professionals alike. Women who want a second child need to know the well-documented risks of severe bleeding and placenta previa caused by previous C-sections. The NHS is not good enough also at monitoring not just maternal deaths, but also morbidity and monitoring those trends. So although it's very good at spotting when there's a trend in stillbirth or in maternal death, it's not so good at spotting trends in PPH and admissions to ITU, and they both need the same attention. The government has a responsibility to ensure that whatever choice women make, they're informed choices and that the procedures are safe. If they want a home birth, let's make that a real choice. If they want a C-section, let's make that a real choice. And if they want a midwife-led unit, if they want an obstetrician to care for them, let's make that a real choice. And I agree with my friend for the Ribble Valley, who's absolutely spot on. We should move away from making this a binary choice between safety and choice. It's time for us to be proactive and not reactive, and to put into place the processes that will protect future mums from negative experiences of maternity care. That's why I'm glad the National Maternity and Neonatal Task Force, announced by the government last year, is focused on long-term systemic reform, and that actually addresses the systematic failures identified by the CQC. The conversation must include midwives who also want best practice and care for all the mums they work with more than anyone else. It must ensure oversight and accountability and robust reporting mechanisms that supports midwives as well as mums. The word midwife, not many people will know, is Middle English. It literally means with woman. And that's the crucial point. Midwives across the UK are advocating for women, supporting women and sharing their expertise with women all the time. But that's also why we need to make continuity of care a reality for women, so that you can be with woman throughout the pregnancy and the birth. And with the investment in staffing needed to allow rotas to cope for that gold standard that everyone wants, both for pregnant women and for midwives. I was proud to host a drop-in for the RCM with a colleague for the member for Bishop Auckland earlier this year. And I want to put on record that my wife is a midwife. In fact, she's one of the main reasons that I'm standing in this building today. I came into politics to change the situation for women who are suffering, but also to help to get more midwives into the profession. It's not been explicitly said, but let's be honest, the last government failed to invest in the NHS and it failed to invest in the right number of midwives. My wife came home night after night saying, we simply are understaffed, we're chronically understaffed. She was really worried about the standards of care that would there be provided and whether it was safe or not. I said, instead of writing about maternity crisis, I want to do something about the maternity crisis. So that's why I became an MP, to invest real hard money into the NHS and into staffing, but also into making sure that we change the procedures and reform the system. It's really worth saying that actually it's not just about staffing as well. It's about the right culture, it's the right leadership, it's about whether obstetricians and midwives talk to each other, whether on the same side, and crucially about whether women are listened to throughout the process. There's been far too much avoidable trauma for far too many women, as several inquiries have found. For my own constituents in Rochdale, the Royal Oldham Hospital maternity services are often of high quality. I've met senior midwives who are trying to provide innovative solutions to the challenges they face. But let's be honest, there are too many times when women are let down at the Royal Oldham. The CQC survey of patient experience, published in December 25, found some unacceptably poor levels of care. On labour and birth, the hospital scored much worse than expected than other trusts. On staff caring for you, much worse than expected compared to other trusts. On care in hospital after birth, much worse than expected compared to other trusts. And on that last measure, they had an appalling score. This is on care in hospital after birth, an appalling score of 5.4 out of 10. Now, it's clear that this debate today, there's been a huge amount of work undertaken to deliver what we all want. Maternity services that are well-informed, personalised and safe for all women, regardless of race or background. We owe it to every family to provide maternity services where mums are given a full range of informed choice, backed by the medical evidence, and where they're listened to, genuinely listened to, and where compassionate healthcare is at the heart of every single birth. There is excellent care in the NHS. We should say that again and again, but we need to make sure that every area, every trust, every woman gets the high quality of care that they truly deserve.